Hey guys, my name's Kennedy, and today we're going to talk about the depolarization of the heart as well as contraction of the heart tissue. So first off, I'm going to do a quick anatomy review with you guys. So I have a little diagram of the heart. So the heart has 4 chambers. It has left and right atrium and left and right ventricle. So their atriums are at the top, ventricles are at the bottom. And we're going to go through quick blood flow of the heart. So blood is going to enter through your superior or inferior vena cava. It's going to go to your right atrium, to your right ventricle, to your pulmonary artery, and that's going to exit out of the heart to your lungs where the blood gets oxygenated, and it's going to return back to the heart through the pulmonary veins, and then it's going to enter to your left atrium, to your left ventricle, and then back out of the heart through the aorta, and that's where the blood goes to the rest of the body where it delivers oxygenated blood. So that is a very quick and fast rundown of blood flow through the heart. But now we're just going to dive a little deeper into something else, and that is depolarization of the heart, also kind of like electrical signaling of the heart. So what exactly is depolarization of the heart? I like to think about depolarization like contraction of the heart, because when the heart depolarizes, it's going to cause an effect of contraction. So depolarization is when cells become more positive due to the influx of sodium ions. So when sodium ions rush into the heart, and we'll go into that in a minute, it's going to make the cells more positive, causing depolarization, causing contraction of the heart. Now, repolarization is when the cells become more negative, and that's going to cause relaxation of the heart. So, depolarization, contraction, repolarization, relaxation. And why is contraction and relaxation important in the heart? Well, that is how blood is able to move through the heart. Otherwise, it would just stay stagnant sitting in the heart, and we wouldn't be able to deliver the oxygenated blood to the body, which is essential for living and breathing and everything else that goes on in the body. So let's talk about the electrical pathway of the heart. And the electrical pathway is just going to allow the depolarization and repolarizational signals to occur. So we're going to start up here in our right atrium. And this little black dot I have drawn in is going to represent our sinoatrial node, also known as the SA node. So that's what I'll be referring it to. And then we have our AV node, and that is also called our atrioventricular node because it lies between the atriums and the ventricles. And then this black line I drew down the septum, that's also called our left and right bundle branches. And then the little arrows I have drawn going around the heart are Purkinje fibers. So let's run through this. Electrical signaling starts in our SA node. It goes to our AV node, it goes to our left and right bundle branches, and then it goes out and around to our Purkinje fibers. So when depolarization occurs in the SA node, our atriums are going to contract, forcing, and you can kind of see with the color drawn in these diagrams, the blood flow and electrical signaling, forcing blood into the ventricles down here. And so when it reaches our bundle branches and stuff and the Purkinje fibers, that's when our ventricles contract, pushing the blood out of the heart. Alright. So like I mentioned earlier, depolarization also means when the heart cells become more positive, and I said that was due to an ion called sodium. So our heart, it likes to rest at around -70 millivolts. So that's when our heart is relaxed. It is not being depolarized at the moment, but when the heart cells become a little less negative, so more positive, that's when the heart depolarizes and contracts. And this is due to the influx of sodium coming into the cells. So sodium channels are open and it's going to rush into the cells, causing depolarization of the heart, contracting the heart tissue. And then the sodium channels are going to close right where that peak is, and potassium is going to rush into our cells, and that's going to bring our resting membrane potential back down to -70. So our cells are going to be more negative at this point because we are going back down. So sodium comes in, become more positive. Potassium comes in, become more negative. So that's just a simple diagram showing the depolarization and the repolarization of the heart due to sodium and potassium. So that's more on a micro level of depolarization, but it's very important because that is literally how we're able to depolarize and repolarize, is due to these two ions. So now we're going to talk about contraction of the heart a little more, and we're also going to go to more of a micro level with this. So we talked about sodium and potassium, but now we're going to talk about another ion, calcium. And calcium is super important because this actually allows the fibers in our cardiac tissue to come closer together and contract. So because of this ion, the tissue is able to come together, creating that contraction of the heart. So I have this diagram right here, and it kind of looks like a whale, super cute. So I'm going to walk us through the flow of calcium in our sarcolemma, and that's just in our muscle, our cardiac muscle tissue, our sarcolemmas. So we're going to walk through this. So I have calcium. It's going to be coming down T-tubule. It's going to enter through calcium gates, and it's going to go across these little feet into our sarcoplasmic reticulum. So calcium enters the SR, and then it's going to exit the SR, where it attaches to troponin C. So we have 3 different troponins right here, but it's going to attach to troponin C, and when it attaches to troponin C, tropomyosin is then going to unbind from actin. Actin are these little bubble things right here, circles. So tropomyosin will unbind from actin, revealing actin to the myosin, where the myosin heads will be able to bind on to the actin, grabbing the actin and pulling it together, and that's creating the contraction of the heart. So let's run through that one more time. Calcium comes down the T-tubule, goes through the channels across the feet into the SR. It exits the SR where it binds to troponin. Troponin, that binding to troponin releases tropomyosin from actin, where myosin is now able to latch onto actin, pulling it together, creating the contraction. So that is a super in-depth model of how contraction works on a micro level. And that is due to calcium. So calcium plays a very vital role in heart contraction and other contractions of the muscles. All right. Now going back to the electrical signaling of the heart, I'm just going to briefly touch on a basic EKG wave. So an EKG is an electrocardiogram, and that measures electrical signaling of the heart, like we've been talking about. We ran through the SA node, AV node, left and right bundle branches, and Purkinje fibers, and now we're going to kind of show that side by side with an EKG strip. So I'm going to draw out a very healthy individual who has a great PQRST wave. So this is an EKG P, Q, R, S, and T is what comprises an EKG strip. So this shows the electrical signal of the heart kind of on paper. So we've already seen it on the heart diagram, but now we're going to look what it looked like on a strip of paper if we were to have an EKG done. So when the P wave occurs, that is when there will be atrial depolarization. So this is where the atriums depolarize. So that's when they contract. And then the QRS complex, when the signal is right there, that's when we're going to have ventricular depolarization, as well as atrial repolarization. So when the ventricles are contracting, the atriums, which had just previously contracted, are now relaxed. And then finally, we have the T wave, and that is going to represent ventricular repolarization. Okay, so this is just, we're not going to go into any more depth. This is just your basic PQRS T wave. This is what a healthy wave should look like. If it's messed up for some reason, that means maybe the ventricles are not contracting correctly, or the atrium is not contracting correctly, or repolarizing, whatever it may be. So now we're going to briefly touch on cardiac ablation. And so what is cardiac ablation? So we just talked about a normal sinus rhythm, P, Q, R, S, T. But when people have cardiac ablation, which is basically applying heat or cold energy to create tiny scars in the heart tissue, it's going to block irregular electrical signals and restore typical contraction and relaxation. So someone whose wave is skewed up, they don't have the normal PQRST wave, they're going to have some crazier lines. That can be known as AFib, or atrial fibrillation. That's when the atriums are not able to fill up and contract like they should. They're just going to be fluttering, like, and it's not going to be a complete contraction of the atrium to deliver the blood to the ventricles. Not good. So when we have something like AFib, those people, if medication does not work, they can have something called cardiac ablation, where they go in with a catheter up through the heart, and they're going to either apply heat or cold energy to create some tiny scarring in the heart to restore the electrical signal, because we want the normal contraction and relaxation of the ventricles and atrium, like in the normal PQRST wave. So how long does it take for our heart to go back to that normal sinus rhythm? That's what we like to call a normal wave, is a sinus rhythm. It can take, it depends, I think normally like 2 to 4 weeks for a normal sinus rhythm to go back to normal once the cardiac ablation has occurred. So it's a really cool procedure, and it allows your cardiac rhythm to be restored. So our depolarization and repolarization of the heart remains normal, and the heart tissue is, the heart is being conducted regularly. So this was kind of some more complex ideas we had today. We talked about the depolarization, repolarization of the heart, how the electrical signaling occurs. We talked about sodium and potassium, and how depolarization means the heart is more positive and repolarization is more negative. We also talked about calcium, and how calcium actually allows our heart tissue to contract. And then we talked about cardiac ablation and when that would be necessary, and if our heart returns to that normal sinus rhythm. So thank you guys for watching my video today. I hope you learned something, and have a great rest of your day and keep learning.